This photo might not look like much, however, there's a lot happening here that most people don't know about. This is Canada, and for most residents in the area, it's a pretty common sight. You may know Canada for plenty of things like hockey, maple syrup, or even moose. What you may not know is that this is one of the few places in the world that's legalizing human euthanasia and assisted suicide. You may be thinking to yourself, what even is human euthanasia? Human euthanasia, also known as assisted suicide or medical assistance in dying, is a medical procedure in which a dose of lethal medicine is consensually given to a patient. This medicine will then cause the patient to lose consciousness before ending their life. Those who qualify for euthanasia are terminally ill patients that are living in constant pain and discomfort. Now that you know what human euthanasia is, let's dive into why it's important that patients have access to a euthanization service. Firstly, by implementing a euthanization program, healthcare systems around the world can save millions of dollars on treatments that are being used on people who don't want to continue living. Aaron J. Trachtenberg and Brandon Mann say, assuming a low-cost scenario in standard end-of-life care, in essence base case analysis, we expect that net health care costs would be reduced by $33.2 million per year if 1% of deaths are due to medical assistance in dying. If the healthcare system saves that much just from a small percentage of deaths caused by euthanasia, imagine the research or new treatments that can be funded with this extra money. In short, the less money used on treatments to prolong a suffering patient's life means more money to use for the patients who do want to live. Secondly, the actual administration of the lethal drug is easy and humane. As Madeline Lee states, early in the framework's development, UHN chose to limit medical assistance in dying to the intravenous administration of lethal medications in the hospital. In other words, they give the medicine to the patient intravenously, or through the veins, by means of an IV. Besides the prick of the needle, this procedure is painless. Finally, the patient has full control over the euthanization. They get to choose when they die if they're eligible for it. They have to request euthanization, learn about the process and its consequences before waiting a short period of time. After this period of time is over, they can either choose to go through with the euthanization or they can opt out of it. Patients have until the drug is administered to opt out, so they can wait until the last minute to deny euthanization. Knowing all this information, you might be wondering who's against human euthanasia. While there are a lot of people and organizations that oppose this, the World Medical Association is the most outspoken about their disapproval for human euthanasia. In their declaration adopted in 2019, the World Medical Association states that no physician should be forced to participate in euthanasia or assisted suicide. The World Medical Association also says in their preamble that many palliative and life-sustaining measures require technology and/or financial resources that are simply not available in many places. Finally, in their principles, the World Medical Association states, in the care of terminally ill patients, the primary responsibilities of the physician are to assist the patient in maintaining an optimal quality of life through controlling symptoms and addressing psychosocial needs, and to enable the patient to die with dignity and comfort. The World Medical Association brings up some great arguments when it comes to human euthanasia. However, doctors aren't forced to partake in euthanasia. According to Lee, the assessment and intervention teams are constituted entirely of physicians and nurse practitioners who have volunteered to participate. Patients should also be able to determine when they want to die to keep their dignity. There's no dignity when someone is suffering, and it's cruel to deny them the right to die. The actual cost of euthanasia is lower than the cost to continue with treatments if the patient wishes to die. Trachtenberg and Manns looked into the cost of euthanasia, and they state, costs for these alternate regimens vary between $25 and $326 per case. So how can we push for the legalization of human euthanasia? We can begin by educating the public about the positive aspects about it. There are so many negative stereotypes that come with euthanasia that it's damaging to its reputation. We can also shed light on how miserable terminal illnesses are and how much pain that their patients have to endure. If a terminally ill patient decides that they want to die while they're suffering, why should we deny them that right? If we have the right to live, shouldn't we have the right to die?